Welcome everyone. In this presentation I'll be covering the topic of depression, looking at a holistic approach for recovery, for healing from depression. Depression is a mental health diagnosis referring to states where a person feels symptoms such as a lack of energy, low motivation, changes in appetite and or sleep patterns, a sense of hopelessness, and a withdrawal from their regular interests and routines. We can look at depression in this mental health context as a reaction, a coping response that occurs when life brings us loss, disappointments, disillusionment, and other challenging experiences. In modern psychiatry, there tends to be a strong focus on biochemical correlates of depression. It's important to understand that the mind and body are not separate and that they both influence each other, that the biochemical level is not the sole level of who we are, and it's typically not really the causal level, the root source of what's creating our symptoms or conditions. We want to be able to look holistically, looking at the mental, emotional, spiritual, and physical levels. When things are flowing well in our life and we're engaged in life, our body produces chemicals that lift our mood and provide us energy and stimulation to be active and sociable. When we disconnect ourselves from life and from being motivated, then our body will change its chemistry accordingly, enabling us to experience feeling lethargic, low, and withdrawn. Unless there's a deficit in neurotransmitters and hormones that's due chiefly to malnutrition or biochemical disruptions such as drugs or toxins, then focusing treatment on drugs or even just on supplements may produce only minimal or brief effects. We want to be able to look at the holistic approach, as I've stated, so we don't want to ignore the physical level, but we don't want to overly focus in on it, being so narrow in our approach that we're missing out on the big picture and neglecting the deeper causal levels of what someone experiences. Unresolved grief and trauma is a typical psychological level cause for people experiencing depression. On the spiritual and psychological level, depression is often seen as stemming from unresolved grief or trauma. Imagine that things are moving forward in your life, and then suddenly one of these things occurs. Someone close to you dies, you're in a debilitating accident, your spouse or lover leaves you, you lose your job, a tragedy strikes your country or your community, or even a combination of those types of occurrences. Any of these occurrences could lead a person to become sad or withdrawn. If you don't fully process and release grief and other emotions associated with these experiences, you might become stuck in a depressed state. It's not bad or wrong to be in that state. It's normal, it's part of the human experience to feel low sometimes, to feel sad or depressed. In a sense, it's nature's way of helping us pause and regroup our energy and finish processing the trauma before we re-engage with life and go forward. However, people can become so accustomed to that state that they find it hard to imagine being happy and motivated again. The emotional weight or density continues to hold them in place and literally stifles their energy flow leading them to withdraw and reduce their engagement with the world around them. In these circumstances, it is helpful to have some support in clearing the emotional burden and reconnecting with a positive flow of inspiration and aspiration in your life. As an energy healer, when I perceive or tune into people's energy fields, I frequently feel the weight, the density, the heaviness that's stuck there, the places where they've had those emotional pains or traumas where they haven't released it yet, where it's still there influencing them and disrupting that flow of life energy, disrupting that creative force from going through them and guiding them forward. Remember to not judge or belittle yourself for feeling depressed. It is not something to feel ashamed of. Not everyone will understand or accept what you are going through. Don't take that personally. Just be patient with yourself and your own healing process. Recognize that using drugs, whether those are recreational or prescribed drugs, is not a genuine solution to what you are feeling. The drugs can't address any of the actual causes of depression. They can tamper with biochemical systems to temporarily elevate or diminish levels of chemicals in your body. However, this leads often to negative withdrawal effects or other side effects. For example, there are the SSRI, selective serotonin reuptake inhibitor antidepressants, which block serotonin uptake so that serotonin will stay active longer in your body. As a result, your brain may decrease its serotonin receptors or its own serotonin synthesis, so when the drug wears off, you might have an even greater serotonin drop-off than before you began using the drug. This is a form of drug withdrawal-induced depression that people may misunderstand and will allow it to fuel dependency or addiction, believing mistakenly that it is their own baseline depression that they need the drug to cope with. Our internal biochemical orchestration is complex, and trying to override symptoms with drugs is dangerous. Instead, we can shift our focus toward holistic healing aids, practices that bring our life into more balance and harmony, resources that are safe. First, we're looking at mindfulness and meditation. These are practices that give us some awareness of our own mental processes and the ability to sort of detach or let go of thoughts, to let go of the mental chatter, and to be able to look at things perhaps from a different perspective, where we're not caught up in our thinking, we're not overwhelmed by emotions that have been triggered by those thoughts. Another healing aid is somatic therapies, forms of body work, methods of releasing cellular memory. The weight of our experiences is often held in our cells. Our body holds on to energies and memories, and by using these somatic therapies, we can sort of release or unlock what's been stuck there, allowing it to come out so that it could be reprocessed and released, so that we're no longer holding on to those burdens. Energy healing, biofield therapies like Reiki, healing touch, quantum touch, bioenergy, those methods can also help us release the weight that we've been holding on to. They can do it by directly accessing the energy field and allowing that field to release the tension that's been stuck there. to let go of the density that's built up so that our energy could start to flow better. Hypnotherapy is a method of communicating with our subconscious mind, and there we're able to provide positive suggestions to help the subconscious mind shift its outlook on things, its way of interpreting life. And we could also use regression hypnosis to access memories from the past, experiences that need to be reprocessed or released, an opportunity to let go of any emotional weight or burden that we've subconsciously been attached to or been holding on to. Another holistic approach involves shamanism, and in addition to some of the spiritual practices and energy practices used by shamans, they work with psychedelic plant medicines that bring a person rather quickly into a meditative sort of state where they can transcend the barriers that the conscious mind may put up and begin to access feelings and emotions, thoughts and beliefs that have been stuck, that have been keeping them in that depressed state. This is ideally done with the guidance and supervision of a skilled shamanic practitioner, someone who can help you as these things come up from your subconscious to enable you to effectively process them and move past whatever's been holding you down. Breath work is another holistic healing aid. Our breath brings through our life force. It can help move energy in our body. It can help us release emotions. It actually helps nourish our body. So there's a lot of benefits to using breath work. Sunlight, vitamin D, that's something that can be important to our health and well-being, to our circadian rhythms. Getting adequate sleep will benefit our emotional state. So making sure we're getting enough sunlight and enough sleep at the proper times, those can have an impact on our emotional health. Working with nutrition, with diet change, healing the gastrointestinal system, the gut, using foods and probiotics, herbs and enzymes. Our mental health is often affected by our GI tract, by how we're digesting or not digesting foods. The solar plexus chakra, which tends to govern that area of the body and those organs, is related to our personal power and how we respond and react to our life experience. So if we're tense or stuck there, that will tend to have a ripple effect, influencing our nutrition, influencing how our nervous system is operating, and so on. Another valuable access is finding sources of peace, connection to spiritual guidance or support. This may be through a group or community, or it may be through your individual personal spiritual practices. You can also use energy-oriented exercises like yoga and Tai Chi, or more aerobic types of exercises, swimming, running, biking, working out at the gym. Also dance and movement arts. These can all help get our energy flowing and help our body create more uplifting chemicals, things that boost our mood. For many people, communing with animals and nature is helpful. It gives them an uplifting experience. It brings them a sense of connection or meaning. With our body, the endocrine system is important. This includes all the major glands, the adrenals, the reproductive glands, the pancreas, the thymus, the thyroid, pineal, and pituitary. These all regulate hormones in our body. So if we have any imbalances or disturbances with those, that can affect our mood and energy levels. Often we need to change our lifestyle or our diet to help the endocrine system come back into balance. For many people with depression, it's helpful to find new interests, a new sense of meaning or purpose in one's life. Often our past experiences have disconnected us from our previous path or mission, and we need to recreate ourselves to find a new path or new purpose. Looking deeper at depression, we can see that metaphysically, depression may result when we misinterpret our life experiences, feeling shame, guilt, or worthlessness, having self-judgment, or anger and resentment toward life and the Creator for how we have been treated by people and circumstances. At the extreme of this, people may feel that it would be better to not live and may become suicidal. The antidote to this is embracing self-worth and finding acceptance toward the past and hope for the future. Clearly, we can't change the objective events of the past, but we can change our subjective perception and response or interpretation, the narrative that we tell ourselves about those experiences and their meaning in our life. We can reframe and re-examine what those experiences may have been there for, how they are part of our personal evolution, and be at peace with them so that we can start to shift more toward living in the present and having hope or trust for our future. For those who are seeking additional information and support with healing and recovery from depression, I invite you to visit my website, phinsights.com. For now, I want to wish everyone a wonderful day. Namaste.